Hey there, welcome back to East Texas Live on KETK. Dr. John Michael Cline is back in studio today from Azalea Orthopedics, and he's going to teach me something. I do not know what this new procedure y'all have, Platelet Rich Plasma. Dr. Cline, what is that? So
Platelet Rich Plasma is it's a newer procedure that we're doing to help people, another non-surgical option for people, and the basis behind it is drawing a patient's blood and taking that blood and healing injuries that have happened.
Okay, so to the layman, platelet is the stuff that makes scabs, and plasma is the liquidy part of blood. I know these are terrible technical terms to tell a doctor, but how does that help sports injuries?
Well, you're exactly right. So platelet-rich plasma is basically composed of those two things. So plasma is basically it is a medium through which your red blood cells and your white blood cells and your platelets live. So it's the liquid portion of your blood.
The lazy river.
That's
of your
right. The lazy
yeah.
river. And platelets are they're most commonly known to help with clotting blood, but they also have proteins that help with healing injuries called alpha granules, and we use those to heal injuries.
How new is this?
It's been done for years. Probably the first people to do it are known to do it are more commonly professional athletes. So they've been doing it for years, and they were starting it over in Europe probably 15, 20 years ago.
Are you the only person in the East Texas area doing this right now?
I think there's several that are starting to do it, but there aren't many.
Okay, yeah. So who would be a candidate? Y'all shorten this to PRP, platelet rich plasma?
Yeah, PRP, yeah.
Who's eligible for this? Who needs this?
So patients that have suffered from chronic joint and tendon pain, so patients with arthritis and tendinitis are great candidates, or patients just looking to heal injuries quicker.
How long does this procedure take? Is this an inpatient, outpatient, 5 minutes? What is it?
It takes about 45 minutes. So patients come into clinic and they do it all in office, so it's outpatient. We draw their blood by ultrasound to make sure we minimize the number of sticks. We place the ultrasound in a centrifuge, which spins out the blood, separates it by density, and then we inject the platelet-rich plasma into the site of tissue injury under ultrasound.
So you're not even using anything from the outside world, no medicine, no chemicals, nothing from a Bunsen burner or beaker or anything? It's just your own part of your body put back in there?
That's exactly right. So it's using your own body to heal this tissue, which is the great thing about it. So
is there any side effects?
The main side effects are just the normal side effects that you'd get from any injection. So you can always have an infection, you can always, have increased pain, but the side effects are minimal in comparison to the cortisone injections and the normal injections that we do.
So what type of results could be expected? Could this get rid of certain ailments or just make them slightly better?
Well, so typically we'll have, after we do the procedure, patients will have an increase in their pain, but then that pain will get better over about 4 to 6 weeks, and then we couple that with different modalities such as bracing, physical therapy, or other medications.
So platelet-rich plasma. This is new to me. Thanks for sharing with us. If you think that this is something that might be able to help you, you can get more info on what Dr. Cline's doing for people right now. Go to azaleaortho.com. Not the pedics, just this part, just the azaleaortho.com. Thanks, doctor.
Thanks for having me.
All right.